This is Kathy Knepfer, instructor for Nursing 2333, recording the Managing Nursing Care lecture for Chapter 21, Translating Research into Practice. Societal factors that influence the use of research include rising costs of healthcare, quality improvement initiatives, pressures to avoid errors, research about the costs of not implementing evidence, and publicity about research findings. Research is defined by Burns and Grove as the diligent, systematic inquiry or investigation to validate and refine existing knowledge and generate new knowledge. The American Nurses Association and the International Council of Nurses provide support for the significance of research and practice. The ANA, or American Nurses Association, has the Nursing's Social Policy Statement as well as the Code of Ethics for Nurses. They also have published Nursing, the Scope and Standards of Practice, and then the International Council of Nurses have published a position statement on nursing research. Expectations for professionals. Professionals should know where and how to find the best possible sources of evidence. They should formulate clear clinical questions. They should search for relevant answers from the best possible sources. And they should determine when and how to integrate findings into practice. Research can be used in a variety of forms. The first is enlightenment, implementation of a research-based protocol, and widespread adoption of standards based on research findings. This slide lists a few of the many research designs that are often used in nursing research: basic versus applied, qualitative versus quantitative, cross-sectional versus longitudinal, descriptive versus experimental, and retrospective versus prospective. Research application. Some research is ready for application and some is not yet ready. Readiness for application is not necessarily dependent on the research design. A single study may provide sufficient evidence for implementation. The quality of care and the quality of the outcomes of care can be dramatically improved with the implementation of evidence-based practice. Requirements for the development of an evidence-based practice include a clearly written clinical question, a more thorough search of the literature, a review of single studies, meta-analyses, critically appraised topics, systematic reviews, and/or clinical guidelines. It also requires appraising the evidence and placing evidence in the context of patient, family, and community values. The National Institutes of Health, or NIH, roadmap include new pathways to discover, new strategies for diagnosing, treating, and preventing disease. NIH also addresses research teams of the future, such as interdisciplinary teams and public and private partnerships. The roadmap includes re-engineering of the clinical research enterprise. This would involve clinical research networks, policy analysis and coordination, chronic disease outcomes, as well as translational research. The American Recovery and Reinvestment Act of 2009 set aside $1.1 billion for comparative effectiveness research. Research utilization involves reading the research and then examining it for its applicability to practice. The nurse would use the knowledge from the research to make a change in practice. An example would be reading a research report on how to most effectively teach new mothers how to breastfeed, and then applying that research results to the clinical setting. Stetler has a model for sustaining evidence-based practice. This is in Figure 21-1 on page 387. The steps of Stetler's research utilization model to facilitate evidence-based practice include preparation, validation, comparative evaluation and decision making, translation and application, and then lastly, evaluation. Evidence-based medicine is the integration of the best research evidence with the clinical expertise and the patient's unique values and circumstances in making decisions about the care of individual patients. This is by Strauss. The use of evidence-based practice denotes the use of evidence by all healthcare practitioners. Evidence-based practice, or EBP. It's important that the nurse search for the best research-based answer to a clinical practice problem. An example again would be a new mother not breastfeeding even after receiving instruction. As a result of that, a research-based protocol is developed based on the best scientific evidence about teaching breastfeeding. And remember, evidence-based practice includes consideration of patients' preferences. There have been some improvements in selected practice areas for nursing based on evidence-based practice. They are preoperative teaching, pain management, assessment of children's behavior, fall prevention, risk detection for pressure ulcers, incontinent care, and family-centered care in intensive care. Translation of research into practice, or TRIP. This is defined as the science of how research is best translated into practice. And if we talk about breastfeeding again, the example would be the best strategies for getting staff members to use a new evidence-based protocol for teaching new mothers about breastfeeding. This is also known as translation science. The definition of comparative effectiveness research by the Institute of Medicine, or IOM, is the generation and synthesis of evidence that compares the benefits and harms of alternative methods to prevent, diagnose, treat, and monitor a clinical condition or to improve the delivery of care. The Foundation for Comparative Effectiveness Research, or CER, tests the efficacy and the effectiveness. Efficacy is testing an intervention or treatment in a traditional research study, such as a randomized clinical trial, RCT, and this would be under carefully controlled conditions. They test effectiveness on whether an intervention works in the real world of practice with a focus on the decision needs of clinicians and patients. The first step in evidence-based practice is to ask the right question. The P stands for patient population. It could be a group of adults or a group of children. The I stands for intervention and interest area. So what is the intervention that we're focused on? The C stands for comparison. And this is what the intervention might be compared with. Outcome, the O, means what are the results? T stands for time. So what is the time frame for this intervention? Is it a relevant factor for this particular evaluation? You can look at page 396 and box 21.5 for a little bit more detail on what each of these stands for. Practice-based evidence, or PBE, is a comparative effectiveness approach. It includes research methodology that helps inform practice decisions by examining outcomes in the real world, where patients may not be similar and the actual applications of an intervention may have multiple variations. Participatory action research is where members of the community being studied are integral members of the research team and are involved in identifying the questions and addressing the issues involved in the implementation of the research project. Quality improvement uses data to improve processes and outcomes of care. Evidence-based practice focuses on the incorporation of the best scientific evidence into specific care processes. Nurse-sensitive outcomes are outcomes directly related to the quality of nursing care. Examples would be falls, nosocomial infections such as urinary tract infections, and pressure ulcers. The Patient-Centered Outcomes Research Institute, or PCORI, was created under the auspices of the Centers for Medicare and Medicaid Services, or CMS, and this was by virtue of the Affordable Care Act of 2010. This includes stakeholder input, and it's focused on improving healthcare systems, communication and dissemination, addressing disparities, and accelerating patient-centered outcomes research. Let's review Rogers' theory called Diffusion of Innovations and its stages. It's a theory about communication. And it reflects how innovations are spread through society. First comes knowledge or exposure to the information, then persuasion, individuals have an attitude development, decision where there's a commitment to adoption, implementation where it's applied to practice, and then confirmation. And remember, it's a theory about communication. In the knowledge stage, where information is disseminated, it might be through journals, conferences, educational programs, the media, as well as literature review. The persuasion stage. Persuasion may be performed through informal communication networks, through the use of a champion. Attitudes may be positive or negative during this stage. It's during the decision stage that there is a commitment to adoption. So it might be adopted or it might be rejected. Questions to ask would be what factors might facilitate adoption? What factors might make it difficult to adopt? Direct application occurs during the implementation stage. The application would occur exactly as it was done in previous research and exactly as recommended in a guideline. Reinvention occurs and it's modified to suit the environment. There may be an indirect application, and this would be modified according to the needs and values of the staff. During the confirmation stage, an evaluation of the innovation takes place. A decision is made whether to continue the innovation, discontinue the innovation, or modify it. Let's review characteristics of innovation adopters. Innovators are active in seeking new information. They are the organization's visionaries. Early adopters are the organization's opinion leaders who learn about an innovation and apply it to their practice. They can be effective in communicating the value of the innovation. The early majority won't bring forth an innovation, but will really readily adopt it when brought forth by others. The late majority are skeptics who don't adopt something unless pressure is applied, and they may be part of a backlash. Laggards are most secure in holding on to the past, and they're most comfortable when an idea can't fail. In the next slides, we'll review steps in evidence-based practice. The first is asking relevant clinical questions. Second is searching for the best evidence. Then critically appraising evidence. Integrating evidence with clinical expertise, patient preferences, and values in making a practice decision or change. and then evaluating the practice decision or change. You can look at box 21-4 on page 395. With respect to questions to ask regarding evidence-based practice, here are the questions that we would consider. What kind of supporting information was provided when the practice was changed? When clinical agencies update procedures, who is responsible and how is the latest research incorporated into the practice? What has been the impact on patient care? How are patient values incorporated into the practice change, such as family presence in the ER or the ICU? Other questions to ask regarding EBP are, how has the adoption of new practices been evaluated in your clinical agency? What critical elements are included in the method for evaluation? Has the change been sustained over time, and why or why not? What factors determine whether the change in practice will be continued? Individual strategies for EBP include identifying challenges in providing care, asking questions about agency practices, asking for the evidence for underlying practices. Research networks include practice-based research networks, or PBRNs, electronic data sharing consortia, Veterans Administration Quality Enhancement Research Initiative, and Magnet. And here's another definition of TRIP, or translating research into practice. It's the scientific investigation of methods and variables that affect adoption of evidence-based healthcare practices by individual practitioners and healthcare systems to improve clinical and operational decision making. This includes testing the effects of strategies to promote and sustain evidence-based practice. Organizational issues that often come up with evidence-based practice are lack of resources, limited expertise of staff members, lack of knowledge about nursing research, and limited time for planning. Organizational strategies for implementing EBP are to create partnerships between the nurses and the researchers, involve key decision makers, understand organizational context, support a research culture, build capacity and infrastructure, formulate staff expectations recognition, provide technical support. There are also strategies for nurse leaders and managers, such as partnering with nurse researchers in academia, collaborating with interdisciplinary team members, joining practice-based research networks, establishing journal clubs, using Nurses Association's resources for policy and research, and publicizing successes.